camera off. Our intention is to share the recording on our website after today's webinar. So again, thank you ever so much for joining us. The agenda today is packed and hopefully we'll have lots of very interesting bits for you. Could you just put yourself on mute for me?
I guess
thank
you can't.
That's lovely. Thank you so much. So we're delighted to have Dr. Sarah Mitchell with us from NHS England, who I'll be handing over to in a minute. After Sarah speaks, I'll just be talking you through NACEL and the quality improvement efforts that we are making. Heather is going to launch the quality improvement section on our NACEL website today. We're going to spend a decent amount of time navigating through the data and improvement tool with Rosie and David. And then at the end, there's going to be time for questions, and we're going to have a think about how future webinars can help support you. Next slide, please. So if I can hand over to Dr. Sarah Mitchell to take us through the importance of audit and quality improvements. Thank you, Sarah.
Thank you, Jess, and thank you to the team for having me. As Jess says, I'm Sarah. I am the National Clinical Director for Palliative and End-of-Life Care. I work clinically as a GP in an area of socioeconomic deprivation and a care home GP, and I also am an Associate Professor of Palliative Care at the University of Leeds. And I'm really pleased to be here at this webinar and working with the NACEL team to highlight and talk about the importance of audit and quality improvement as part of audit in producing the system change that we require to improve palliative and end-of-life care. So can I have the next slide, please? Just to place it sort of firmly in context, why do we do all this work that we do together? Well, it is for patients and those important to them. We are working together towards producing high quality, personalised and proactive palliative and end-of-life care for all people in all settings. So our learning from NACEL is a really critical part of that. And just remind you of the ambitions that we have to make the last stage of every person's life as good as possible, because professionals work together confidently, honestly and consistently to help them and the people most important to them. In my role as National Clinical Director within the new NHS England operating model, my role is to work with the team to enable local systems and providers to improve palliative and end-of-life care and reduce inequalities. We want to promote understanding that through the delivery of high quality palliative care, people gain job satisfaction and feel that they can make a difference, and that is important in our work life. Our collaborative working is important to make sure the workforce is equipped with the knowledge, skills, values and behaviours to deliver that accessible, compassionate palliative and end-of-life care that everybody would need. And we've got a responsibility to optimise the use of digital technology, research and innovation and deliver value for money. So our learning from NACEL is relevant across all of those priority areas. Next slide, please. So we're really fortunate to have that close collaboration with the National Audit for Care at the End of Life. In fact, we're really lucky to have the National Audit, and the learning is important as we work towards this delivering the legal requirement in ICBs. If you could just press the next slide button. Our big lever is that there is now a statutory duty across all integrated care boards to be commissioning palliative and end-of-life care services for their population as part of the health service. And such a big part of that is understanding our population need and the patterns of care and opportunities for quality improvement. Can I have the next slide, please? As an integrated care board, you'll be thinking about the whole system, and I know that the NACEL audit looks at certain parts of the system in more detail, but I just thought I'd share with you this slide of the palliative and end-of-life care dashboard. This is accessible to people with an NHS email it's via the NHS Futures platform, and if you would like to have access and don't have it already, please email our palliative inbox, which I can put in the chat afterwards. It's a really interesting and interactive dashboard that gives us quick insights into what is happening at every different part of the system. And on this particular screenshot, you can see I've focused in on the hospital care that's being delivered. So this is all deaths in hospital through all the quarters since 21-22. And you can see that, we can see some patterns there, both in terms of cause of death. So with a large proportion of deaths being around frailty, but also big proportions in organ failure and cancer. But a really also interesting trend around deprivation there, with hospital care being delivered perhaps for some of our most vulnerable patients who come from the most deprived areas of the population. And some of the figures here, I think, are also really, really interesting. So we know that the average number of days known to services, and that's hospital services, is 63 before the end of life, and the average number of contacts is 4 in the last 90 days of life. But you can see a bit more across the bottom, some information about the nature of those contacts. So urgent and emergency admissions are a really big proportion of the contacts. So whichever way we look at it, a lot of end-of-life care is happening in those acute trust settings, and the National Audit for Care at the End of Life really helps us to drill down and shine a spotlight on exactly what, the nature of activity that is happening in the hospital system around that care. Can I have the next slide, please? So the importance of quality improvement through national clinical audit. I'm a real fan of audit. I think it's brilliant to be measuring things, but measurement without improvement wastes time and money. And I found this quote from a report that's 10 years old, actually, around the importance of the national audit and the opportunity for quality improvement. And there were just some practical issues within that report that I thought were worth repeating and revising together. The audit gives us an opportunity to think about improving quality of care that patients receive, and it'd be great, wouldn't it, to be talking to all our professional colleagues about their opportunity to be improving the quality of care that patients receive through taking part in this audit. And quality improvement is a big part of the National Clinical Audit Scheme, so that is great. I know the team at NACEL are thinking really, really hard, and they have been thinking through this webinar about how the presentation of data is important and making it accessible so that staff in different care settings can easily use the data that comes out and the recommendations that come as a result of the audit. And we are all really cognizant of the fact that we need time and space for staff to contribute to the interpretation and use of information. And I know the team will be working with those taking part in the audit to see how that is going, and share the learning across the systems. I think learning from NACEL and the quality improvement activities that will be undertaken as a part of the audit will inform end-of-life care both in trust but also across the wider system. So that's an exciting opportunity for me as I think about whole system transformation. And it would be great if we can make sure that audit activity is strategically aligned with improvement plans across education and training programmes. And then in time, and this relates right back to what I was saying about my role as National Clinical Director about enabling systems, is we need to think about how audit can be informing better payment mechanisms and regulatory activities into the future. So I hope that's plenty to think about, and I hope it gives everybody lots of motivation and enthusiasm for what you're taking part in here. And I'm looking forward over the next 12 months to hearing about the quality improvement activities that come about as part of NACEL and to working with the team on that. So thank you.
Thank you so much, Sarah. Can I have the next slide, please? So Sarah has set me up nicely to talk about how we are looking at quality improvement with NACEL this year and next. Can I have the next slide, please? So quality improvement is something that many of you have focused on for a long time with NACEL data, and we absolutely acknowledge that. In some ways, we're quite late to the party in joining you. It's part of our renewed contract with HQIP on behalf of NHS England to really have a focus on quality improvement and support participants in looking at how they can use the NACEL data to improve work that they're doing. There have been many fantastic improvement efforts from organisations in the past, and we're really keen to learn from those and support organisations along the way. 2023 was a redesign year for NACEL. So myself, Mary, Rosie and the rest of the NACEL team worked hard on some fundamental documents that we really hope will be useful for you as you go into your improvement journeys from the NACEL data. Two of those documents are the driver diagram, which I'll show you a snippet of in a minute, and also the healthcare quality improvement plan and goals. Next slide, please. I didn't want to scare you with our entire driver diagram because it's a really horrible thing to show on a PowerPoint on a Teams meeting. This is a snippet of the 10 primary drivers. We're also referring to these as our 10 quality indicators. And we really hope that these will help anchor aims and goals of improvement work. You can find the full driver diagram on our website. The link is just at the bottom of the slide, and slides will be shared at the end of the meeting. Next slide, please. Everything that we are doing in NACEL relates to those 10 quality indicators, those 10 primary drivers. So everything that you're auditing, every case note review question that you're asking is embedded within those 10 quality indicators, as are these 5 improvement goals that we have set at a national level. And again, these are hopefully helpful to you as you start looking at the data coming back from your local organisation. Next slide, please. So how do we plan to support QI? There are 2 big ways that we are hoping to support QI, and then some smaller ways as well. So the data and improvement tool, which David and Rosie are going to go through in a minute, is our online mechanism to help monitor and report data against the improvement goals and those 10 primary drivers or quality indicators. All of the findings that we gather are reported within that data and improvement tool. So it is really there to help you interrogate your data, hopefully digest your data in a friendly way. And this is our first quality improvement webinar of a series that we are going to be running. And the aim of these will be to help promote quality improvement from the data that we are collecting. We hope to be able to coach quality improvement, share quality improvement ideas, answer questions together, and celebrate successes. Next slide, please. There are some other ways that we want to support quality improvements as well. We are developing a community of practice that is in its infancy at the moment. Essentially, at the moment, what that means is a mailing list that you will all be on. It will initially be hosted by the NHS Futures platform. We are hoping as time progresses that will become a more dynamic and interactive community, very similar to how the NHS Futures community interacts together. There is signposting of quality improvement resources, tools and training on our website that Heather will show you in a minute. We are looking to run a competition next year and link in with other national competitions. We will be identifying and reporting key indicators which align with those 10 primary drivers or quality indicators that I just showed you. There will be a good practice compendium report, which is not new. That has something that has run before, but this time round it will only be NACEL informed projects and work that goes into that. And there are other ways as well, such as the State of the Nation report, sharing information with CQC. Next slide, please. So I would like to hand over to Heather now, who is going to launch the quality improvement pages on our website.
Hi everyone, thanks Jess. I'm Heather, I'm a graduate project coordinator working on NACEL, and thank you all for joining. It's nice to put some faces to the names that we see on the helpline. So as Jess mentioned, I'm just going to quickly talk through the quality improvement pages on the NACEL portal. So they've recently gone live, and they're just intended to be a sort of hub for quality improvement activities for sort of participants in NACEL to get a starting point on how to get started on projects. So there's a bit of information about the quality improvement work we're doing. There's resources that we've kind of compiled, the sign-up form for the community of practice, and there's also a form to submit quality improvement work. I'll just quickly share my screen to show you what the web page looks like. Moment, sorry. Okay, so from the NACEL portal, this is the homepage. You'll see the quality improvement section at the top, and that will take you to the sort of landing page with these answers to some sort of key questions about the quality improvement work that we're doing. You can then navigate to resources, which are broken down by documents, case studies and further QI learning. In the document section, you'll find the healthcare quality improvement plan and the driver diagram. You can then go on to case studies. We don't currently have any case studies, so it's a bit of a call to submit your QI work. But as we collect those and compile them, they'll be available there to sort of share that learning. And then we've got further QI learning, which just directs you to other resources that may be helpful to get started on quality improvement work. We've then got the community practice sign-up form. It's a bit of information there, and any events will be sort of signposted on this page as well. So you can sign up, and as Jess mentioned, it's very early days, so it's starting off as a sort of mailing list, but we've got big plans for the sort of communication and ability to share learning. So that'll be in the works. And we've also got the QI work form, so you just share some information about yourself and your trust, and then answer the questions about the quality improvement work you've been doing using NACEL data. So that is the QI pages on the portal.
Thank you, Heather. It's worth saying any quality improvement work that you submit through to us will be considered for our Good Practice Compendium, and will also be considered for our NACEL competition that we'll be running hopefully next year. So any feedback that you have on the website as well, please feel free to drop us a line. We're really happy to receive feedback and constructive comments. And can I now hand over to Rosie and David to take you through the data and improvement tool?
Hi everyone, I'm Rosie Bonnet and I'm the Quality Improvement Clinical Advisor for NACEL. Just going to run through the timescales and just give you an idea of what David is going to talk about the data improvement tool, and how hopefully today's webinar might be able to stimulate you to go and look at your own data improvement tool and think about how you're going to use that NACEL data to undertake some quality improvement work locally. So there's lots of data coming in now for the 2024 NACEL. If you have been participating, you may know already that the first quarter of the quality survey data has started to be made available through this data improvement tool. And David will talk through about how to access the tool in a minute, if that's something that is still a thing that you need to do yourself. So the quality survey data, which is the second bit down, is the survey from the bereaved families, or those important and close to them. So this information is refreshed regularly. So each time somebody inputs into the quality survey for your organisation, the data updates for your organisation as well as nationally. So one of the things that's useful for you to know is that it's important to think about, if you're sharing that information, is to look at the data that it was accessed, because as more information comes in, the numbers that are displayed will change. And then in July this year, we will have a big change in and an increase in the amount of data that's available, because we will have the first quarter of the first 2 quarters of case note review data being available, as well as information from the staff reported measure. So we will show you where these will come into the data and improvement tool, so that you can anticipate where you may be able to find things as things come out in July. Unlike the quality survey, the information from the case note reviews and the staff reported measures is a static reporting, either annually or quarterly. It's only the quality survey that is updated continuously on the basis of submissions. So you will see that there will be subsequently, for the case note reviews, the opportunity to look at data by quarter, which is new for NACEL 2024. So each quarter of the year, there will be something additional that's reported in the data improvement tool. Hopefully, David will show you the tool and how it works and all the different features that will be coming in. And then we would encourage you to go and start looking at your own organisational data, to start to think about how you might be able to use that for quality improvement. As Sarah said, thinking about how to make best use of the data and how to ensure that it's either strategically aligned to local priorities or the national priorities, which are part of NACEL, is a good place to start. So I'll hand you over to David now, and then we'll be taking questions after he's shown things.
Great, thanks, Rosie. Good afternoon, everyone. I'm David, and I'm the product designer at the NHS Benchmarking Network. So I work with the NACEL team, development team, and our stakeholders to design and build our online products, including the data and improvement tool that I'm here to show you today. So in this section, I'm going to give you a quick overview of the DIT and the different elements that make up the overall tool. I'll run you through how to gain access to the tool so that you can start using it yourself. And then I'll give you a demo of the live data and improvement tool and take you through the structure and the layout and hopefully how to use it. Next slide, please. So in terms of NACEL online as a whole, this is how things look. So we have the NACEL portal, which Heather mentioned and showed you earlier at www.nacel.nhs.uk. So this serves as the starting point for anyone to looking to learn more about the audit. There are links to data collection if you're participating and the data and improvement tool, but also all of those resources that Heather's just launched in the area of quality improvement. And then there's the data and improvement tool itself. So that is at data.nacel.uk.